Okay, a 50-year-old man attends the emergency department with complaints of shortness of breath and palpitations, which started 4 hours ago. He denies chest pain. He has a pulse of 142 beats per minute, a blood pressure of 110 on 80 mm Hg, and a respiratory rate of 20 breaths per minute. His past medical history includes hypertension, type 2 diabetes mellitus, and angina. An ECG was performed which shows supraventricular tachycardia. Carotid sinus massage was attempted, but he is still tachycardic. What is the single most appropriate next management? A. Adenosine intravenously. B. Amlodipine orally. C. Aspirin orally. D. Verapamil intravenously. And E. Digoxin intravenously. And the choice would be A. Adenosine intravenously, and we will explain why we chose adenosine. The next step for management after trying carotid sinus massage would be intravenous adenosine. If the first dose of adenosine is unsuccessful in converting the patient to a normal sinus rhythm, then we can repeat the treatment with another 12 mg IV adenosine for another 2 episodes. But the point is, if the patient is hemodynamically stable, we can start with carotid massage and then IV adenosine, and then after 3 episodes of receiving IV adenosine, if there is no any response, we can start DC shock. But if the patient is not stable, hemodynamically stable, we must think about DC shock in the first line. If there is no any response or the patient is hemodynamically unstable, the next choice would be electrical cardioversion. Note: verapamil is rarely used for supraventricular tachycardia now, unless the patient is asthmatic, in which case verapamil is used instead of adenosine. And in asthmatic patients, we must use verapamil instead of adenosine. And the history of hypertension, type 2 diabetes mellitus, and angina have little or no significance in this question. And here is ECG showing supraventricular tachycardia, and it's supraventricular tachycardia in ECG. It's completely regular rhythm with a beat of 130 to 220 beats per minute, but the rhythm is completely regular.